Good morning and good afternoon. Thank you and welcome to the Weekend Wellness Hour show. Today we have a new connection for me who I met through Dr. Richard Gold, who I had on a few weeks ago talking about sound healing. So Dr. Greg Lane is joining us today, and he's the program director for integral health at the California Institute for Human Science. We're very excited to have him on because he has quite an extensive background in Chinese medicine, acupuncture, and he even has his own private practice as well as a home care practice where he reaches out to people and works with them to help them heal in their own home. So thank you so much, Dr. Lane, for joining us today.
Thanks, Amy. It's my pleasure to be here with you and your wonderful audience.
Yeah, thanks. So can you share with us, why did you even jump into all this, and what led you on this path?
Well, it's funny. I was just having this conversation with a patient this morning. She was talking about finding her own soul's purpose. And I thought, wow, this is a pretty interesting. This was like first thing this morning. I'm like, wow, it's kind of early for talking about our soul, but let's get into it. And I've always been drawn to be of service. Like I was a professional dancer before I was an acupuncturist. You did not know that, but I was. And so and to be of service for me at that point was to be of service through performance and conveying what I was feeling through my dance training and being a performing artist and sharing that with audiences. I toured internationally for a long time, and when I was younger, and so that was my purpose, was to be of service through an art form, through dance. Well, as things happen, professional dancers, just like professional athletes, we train hard, we work hard, we're working with bizarre schedules and bizarre diets, traveling internationally is difficult. And so, I sustained a pretty bad knee injury, in 1989, and I had to have knee surgery. So, a one-legged dancer could happen, but wasn't really in my cards.
Yeah.
So anyway, long story short, I soul searched for myself. What am I going to do? My identity was so wrapped up in being a dancer and training and, performing, and that was my whole life. And so, with the knee injury, I was out, and I was like, okay, what am I going to do? So soul searched, hit the pavement looking for opportunities for what was next. And I had an interest in yoga. I had an interest in meditation. I had an interest in practice in martial arts. And growing up in Southern California, I'd always been a surfer, so I was very connected with nature. So the study of acupuncture and Chinese medicine just sort of fell into my lap. I realized there was a school in San Diego where I was born and raised. And so I moved back to San Diego and I started studying. I had to have knee surgery. I had orthoscopic surgery, but then I used acupuncture, massage, PT, yoga, herbs, meditation, visualization, everything to heal my own body, my own mind, and my own spirit at that point. And then it just cascaded, starting acupuncture college in 1990.
That's impressive. That's amazing. What a shift in your career, and to be able to enjoy the arts in that way. And now you have this combination with science.
Yeah.
So can you talk to us a little bit? A lot of times people associate Chinese medicine with acupuncture only. And we were talking a little bit beforehand that there's a lot more to it. Can you go into that a little bit?
Sure. Yeah. Well, a lot of people, it's sort of backwards. A lot of people just think about acupuncture. They don't even know that there's this whole paradigm of Chinese medicine. Maybe they've heard of Ayurveda from India, but every historical traditional culture, Greek, Arabic, African, Indian, Chinese, Native American, Hungarian, every native tradition across history and across the globe has some form of traditional medicine. The Chinese happen to be, and I may offend some people, forgive me if I do, but I believe that Chinese medicine is the most comprehensive and documented, with written documentation preserved going back in the Han Dynasty, almost 3,000 years ago, in tombs written on, scrolls, outline the fundamentals and the rudiments of Chinese medicine, including acupuncture, herbal medicine, breathing exercises, postural exercises. It's really like an ancient wellness coaching in a way practice. There's all this holistic coaching and integral health we talk about here at CIHS, here at our school, which is a component of mind, body, spirit. Well, that goes all the way back to Chinese medicine. So acupuncture is only part of Chinese medicine.
Okay.
There's herbal medicine, as I mentioned, etc.
And so the term that you use for integral health, that means mind, body, spirit, or is there another meaning behind it?
Yeah, integral health. It goes back to looking at Ken Wilber was one of the proponents of coining the term integral health, but our founder of the college, Hiroshi Motoyama, was committed to bridging the gap between spirituality, consciousness, and science. So integral health is one of our programs here at CIHS. We also have integral noetic science, which I won't go into, and psychology. And all of our programs combine, mind, body, spirit, all aspects of our lives. And so there's a real, that's why I love working with this school and in my own practice, because they blend so nicely. We all, we're committed to the mind, the body, and the spirit, because we recognize that there is no separation. If the body is injured, if the body is ill, the mind can also be ill or injured, as can be the spirit. And if the spirit is ill or injured, the mind, the emotions can be injured, and that can, cause bodily harm as well.
Yeah.
And people resonate with that. They realize that it's like if you're having a bad day, right? Even just like, okay, it's gray outside here in San Diego. I like sun, so maybe I'm a little blue today. Well, what does that do to my posture? I kind of feel, a little bit, maybe I'm not as, we all sense that, but we may not have the vocabulary to name it or be aware of it.
Yeah. Definitely like a heaviness in the body that you may not feel so spry and energetic when the sun is not out. So I get that.
Some people like it gray, but that was just an example.
Yeah, I get what you're saying. Yeah.
Yeah.
So in your practice then, because you have a private practice as well, do you combine acupuncture with some of the other modalities within Chinese medicine and using herbs and breath work and other aspects?
Absolutely. I use a full spectrum of Chinese medicine. So I use, counseling, just talking to someone, just connecting, in a caring, supportive way, just being available as part of a therapeutic intervention, as part of a therapeutic process. Like kind of like Western counseling, just being available. So we employ that. I definitely will recommend lifestyle guidance. I'll work with a patient with their nutrition, with their exercise, with their sleep, with their thinking, and of course applying acupuncture points. But sometimes patients will come in, I'll do just ear points in the ear, and that may sound strange to your listeners who have never had acupuncture. It's like, what, now he pierces ears? No, we don't pierce the ears, but the ears are actually a microsystem of the entire body. So for example, every physiologic and anatomical area or process in the body can be found in the ear.
That's impressive.
Yeah,
that's impressive. While we're talking on this subject, why don't you go into a little bit of what acupuncture is? So most people have heard of the word. Some people have even experienced it, had some needles in them, but don't really understand what is happening physiologically, energetically, what is going on with the body.
Yeah, it's a very good question. It could be confusing because, we talk about qi and Shen and Jing and all of these terms that are they're Chinese names, and people from the West, we don't understand that.
Yeah.
So I like to explain acupuncture. So acupuncture uses fine needles about the width of, if I had hair, it would be about the width of my hair, your hair.
Yes.
And they're very fine filiform needles. They're surgical
Mhm.
stainless steel, they're sterilized, and they're used once individually.
Mhm.
So they come in little wrappers, and we dispose of them just like hypodermic needles are disposed of in Western medical clinics. We put them in Sharps container when we're done.
Okay.
And so, there's a little fear factor. People in our culture may or may not be afraid of needles,
Mhm.
and these. So I like to call them hairs. I think needle was a bad term for the
Mhm.
acupuncture instrument, quite
Mhm.
frankly.
Yeah.
So in any case, that's the tool. The acupuncture needle is the tool. And they come in various shapes and sizes, very thin to thicker. If you're doing points, for example, in the gluteus region, you have a little bit more real estate there. You need to get a little deeper, so the needles are a little longer.
Okay.
And so, we insert the acupuncture needle into various acupuncture points that are specific loci or points or
Mhm.
locations on the body that are on 14, what we call 14 main acupuncture channels.
Okay.
There can be acupuncture points anywhere on the body that there's pain. So for example, if I push here and it's painful on somebody,
Mhm.
that's actually a point too. We call that a sure point or tender
Mhm.
point in Chinese
Okay.
medicine, sort of like trigger point. So
Yeah.
there's trigger point acupuncture as well.
Mhm.
So we don't just guess as to which point. We create a whole picture of the person, a whole pattern. We formulate what we call a pattern of disharmony in the
Mhm.
patient before we select the acupuncture point prescription that we're going to use.
Okay.
And so that pattern of disharmony is found by me or by an
Mhm.
acupuncturist
Mhm.
by our methods of diagnosis, which are looking. So I look at you,
Yeah.
I listen to what you say, I
Mhm.
ask you more clarifying questions,
Mhm.
I examine your color, I look at
Yeah.
your tongue to see the shape of your tongue, the tongue coating, any
Okay.
demarcations in the tongue. I also
Mhm.
palpate the body, I mean, I press particular areas. Maybe
Mhm.
I'll take you through range of motion if I'm doing orthopedic conditions.
Mhm.
I will palpate the pulse. So feel
Okay.
the pulse. You can't see that, but I'm
Yeah.
feeling,
Yes.
I
There
feel
we
the
go.
pulse. We feel the pulse in 3 different positions on both
Mhm.
sides. So we're feeling the radial artery at
Mhm.
3 different depths. So superficial, middle, and
Mhm.
deep on
Okay.
both wrists. And so all of that diagnostic procedure allows me to formulate what's going on with you. And people
Okay.
are like, wow, how did you know that? And it's just, through years of simple observation and then
Mhm.
correlating what those signs and symptoms mean. Then
Yeah.
we formulate a diagnosis and then treat that diagnosis. Everybody's different, even like a headache. Your
Mhm.
headache might be different from my headache, from his headache, from her headache, different origins, different places,
Mhm.
different triggers, therefore
Mhm.
different treatments.
Right. Right. And so when you're going through this process and you decide where you're going to put these needles in a person based on how they present to you,
Mhm.
do you have them just lie down? Do you attach electrodes to them as well? I know sometimes electrical current is used in the process of needles to try to generate a response. Is that something that you do or not do?
That's correct. Yeah. And I'm impressed that you know that.
Yeah.
Yeah. So what you're talking about is electric stimulation.
Mhm.
And I do electric stimulation when
Okay.
it's indicated.
Okay.
I usually use, for example, I have an 82-year-old woman right now with um, inhibited transit time in the lower bowel, meaning
Okay.
she can't poop. It's
Mhm.
difficult for her because
Yeah.
the nerves were damaged through a particular drug, or so I believe,
Okay.
or so she believes, and so some of the research says
Yeah.
that long-term use of this particular drug, which I won't name, impairs the neural impulse to the transit time of the lower bowel. And so I'm actually needling in the sacrum. We have 8 holes. They're called foramen, and there are 8 holes in the sacrum that we needle. I'm not needling all 8 of them, but I'm needling 4 of them, and I'm hooking up electric stimulation leads to those needles to add more stimulation, a little bit of a tick, 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 tick type of a feel, or a little bit of an impulse that's going in and sending signals to those nerves to wake up. Because as long as we're alive and breathing, we have the opportunity to regenerate our cells, all of our cells, including neural cells. That's why acupuncture is so good in post-sequelae of stroke and getting movement back, speech back, taste back, smell back post-COVID. I treated a 17-year-old girl some weeks ago, full facial paralysis from Bell's palsy. After 8 treatments, she was perfectly normal.
Nice.
And so yeah, I use electric stimulation, and you asked me sort of the mechanism. I sort of skipped over that. So what is acupuncture doing? It's going, initially when we put the needle into the body, what's happening anytime anything penetrates the skin and goes into the body? Well, the body recognizes it as a foreign object, right? Yeah. So there's going to be an immune response immediately. So you're going to stimulate the entire immune system to kick in. We're also, these mapped out acupuncture points are on channels, which just so happen, by the way, to correspond to known peripheral neurologic pathways and peripheral vascular pathways. So, the ancients didn't really have the same understanding of physiology and anatomy that we do now through functional MRIs, through nuclear medicine imaging, through CAT scans, through PET scans, through advanced and anatomical studies, through dissection and so forth. They just observed the body in its natural environment and concluded certain things, certain pathways. But now we know that acupuncture is working very specifically in the areas of stimulating blood flow, reducing inflammation, interrupting pain signals from the peripheral nervous system to the central nervous system, thereby stimulating hormone responses, all systems: digestive system, respiratory system, cardiovascular system, genitourinary reproductive systems, gastrointestinal systems, all systems that we are influencing through the peripheral stimulation through acupuncture points.
That's incredible. And I know part of your private practice is helping those who have cancer or had cancer. So what is the main purpose of the acupuncture in relation to people who have or had cancer?
So I've been really very fortunate to work with patients with cancer. Some of my favorite patients, some of them terminal. Obviously, the acupuncture and the Chinese medicine isn't going to cure the cancer, but it's going to help the soul. It's going to help the mind, the body, and the spirit get ready for the next phase of transition. And I've worked with patients all the way up to the end and help them transition over to their next phase. And it's very rewarding to be able to do that. It's very rewarding to help patients cope with a new diagnosis. It's very rewarding to help patients deal with some of the side effects of the very, very powerful chemotherapeutic agents that cause, major digestive and heat, sleeplessness, irritability. All the cascade of side effects is pretty great. And I have excellent oncologist partners that, a lot of people are down on chemotherapy, and I'm like, hey, if you have breast cancer, or you have certain kinds of leukemia or lymphoma, get the chemotherapy. I'm not going to just treat you with acupuncture and herbs and watch you die. I mean, there's excellent allopathic care in the areas of oncology right now. Now, some of it is, there's no 100%, but there's very high percentages. And so the combination of traditional medicine and Western medicine in an integrative way is very, very important. And patients I see do very, very well with that.
Yeah. And there's been so much science and research, to get us to this point. So I can see why we can take advantage of it, but then use something like acupuncture to help with the recovery or with the side effects that the
100%.
medications help you live, but there are definitely side effects. So why not use some other methods to help with that? Yeah.
And the emotional component cannot be underestimated with this population of patients too. And I think that's where I've had my greatest influence and effect in these patients. Just getting somebody who's just, on their multiple rounds of chemo for metastatic breast cancer that's ended up in their liver, and just dealing with that emotionally has really been beneficial for them, and help them just relax a little bit and just open up some space, let go of some fear that can degrade their physiology. If you give somebody the opportunity to shed some of the fear and the anxiety, that creates a space for some healing component that's beyond, what I'm doing. It's maybe their spirit is healing, and having the opportunity for their soul to heal a little bit.
Yeah. And how do you address if someone is a little bit skittish of needles and doesn't like them? Is it something that you say, well, maybe acupuncture is not for you, or is it something that you can talk with them and see if there's still a path to allowing it to happen, that treatment?
Sure. There's some, I treat children.
Okay.
Just had yesterday or the day before, I had what is he, a fifth or sixth grader, real little guy, spry little guy, likes to play baseball, pretty high strung, really kind of high performer, like is on a travel ball baseball team, has a lot of anxiety about his own performance, and was having some digestive issues because he was so stressed out. Like he'd get himself so worked up before a game. But I'm not just going to load him up with a bunch of needles. I use very fine needles, shallow insertion. We're talking about baseball, we're making jokes, going back and forth, and all of a sudden I have a needle in a point that relates to his large intestine, a point that relates to some stress, or a couple points in the ears that help his autonomic nervous system down regulate the sympathetic response. So it just puts him into a parasympathetic response. He doesn't know what I'm doing. And all of a sudden, I see him just kind of drop in his body, relax. I'm just like, okay, hey buddy, you want to just chill out here for a little bit? I'm just going to put on a little music and let you relax a little bit. I'll leave the room, and, he'll relax for 10, 15 minutes. And, children, shorter visits. Sometimes I stay in the room with them the whole time, just depending on how old or how young they are. The mom or the dad will be there. It's usually the mom for some reason.
Yeah.
So yeah.
That's great.
But to your point, everybody has a different pain threshold. Everybody has a different tolerance to any intervention. So it's incumbent upon the practitioner, whether it's me or anybody else, to be very sensitive to who's in front of you and what's needed. What is the level of intervention that needs to happen here?
Yeah, that makes sense. And that's great. So when someone's going through a treatment, you mentioned like for the child, it was 10 to 15 minutes. Sometimes is it longer for adults, and how often they come back, I imagine, is dependent on their condition and what they're coming in for?
Exactly. Usually the longer somebody's had a situation, the more chronic an issue or an ailment is, usually the longer it's going to take to fix.
Okay.
In general terms. Now, there's so much age dependent, constitution dependent, compliance dependent. If I treat you once for an hour and you go home and sit on the couch and eat Doritos and Oreos, followed by beer and whiskey, which I know that's your favorite diet, right, Amy?
Right.
Then we're going to have an issue. But if you leave committed to going for a walk in a beautiful area of whatever part of the world you live in, you meditate, you journal, you have healthy relationships, you're eating well, you're sleeping well.
Yeah.
That prognosis is much different than the Doritos, Oreos, whiskey, kind of watching television, that kind of thing. So really, the scale now, can that person benefit? 100%. Do I need everybody to, take up meditation and yoga? No. No, we have to work with people where they are. If people come in, they say, "Hey, are you going to take away my coffee?" I'm like, no, I like coffee. I drink a cup of coffee in the morning. It suits me. But others, it doesn't. I don't, I eat whatever I want. I'm pretty lucky, but some people can't handle eating raw foods, for example. In Chinese medicine, we like a warm, cooked diet. We don't like greasy foods. We don't like necessarily, we like things to be sort of easier to digest. So it's really individually focused, and that is really what's the beauty of Chinese medicine, is it's so individually focused and nuanced that that's why it's so effective.
Yeah, it's customized to the person and their experience. And when you're going through this and determining the acupuncture aspect and what the treatment plan, how do herbs come into play? Do you recommend them for everyone, but pick and choose which ones for each person, or sometimes you use them, sometimes you don't?
I think about herbs for every single patient because I honestly, I think, the acupuncture is very powerful, but the herbal medicine is really this next level powerful. And so I wish all my patients would take herbs. Some just won't. I have one patient right now who if they're not, I make her drink them I pour them. I don't make her drink, but I have the bottle of her herbs. I have her name on them in the office. And as we're sitting there talking about how the week's been, I see her actually twice a week. I will pour the granules of the herbs, mix it with hot water, and I'll make her tea. And as we're talking, I'll have her drink the tea. Just so I see the herbs going down the cake hole. And because, as I said, this could be the best thing ever, but unless there's compliance, if I give you a set of 15 exercises to do to help you unwind at the end of the day and also relieve your back pain, and you do them once, and then you come back and you say, "Hey, Dr. Greg, did those exercises, they don't work." And then I go, "Well, okay, how many times did you do them?" "Once." I'm like, "Okay, well," same thing with herbs. If I say, "Okay, take 3 spoons 2 times a day between meals in the morning and the afternoon," because I know no one's going to take a third dose in the middle of their day. Never happens. But I figure, twice a day, you put it on the counter, you can see it. That's your structure. You go in the morning and they're on your counter there. That's easy. That's an easy win. And if they stick to that plan, if I've selected the right herb formula, which hopefully I've done, then we're going to get results in the direction that they want to go, which is towards their health goal. So I think about herbs for every patient. I'll discuss herbs with every patient. Not every patient will walk out the door with herbs. But I make it very easy. The traditional herbal medicine is prescribed and given as raw. We select, all Chinese herbal formulas have a minimum of 2 substances in them, 2 herbs, because they work off each other's synergy. Each herb in the formula has a particular function. We have a chief herb, an assistant herb, an envoy herb, and supportive herbs. The chief herb addresses the main complaint, like pain. The assistant herb supports that chief herb in reducing pain. The envoy gets it to the areas of the body that we're trying to affect, like the neck and shoulders, or the low back, or the knees. And the other herbs help to harmonize the effects of the formula.
That's fascinating.
So, but to brew up a traditional formula, like you get roots and leaves and flowers and etc., put them in a pot, bring it to a boil, simmer it for 45 minutes, strain it, do that over again, dilute it. That takes, it takes a substantial amount of time. And just going back to the compliance issue, most people in our culture, they don't make the time to do that or have the desire. So, our industry has made it very easy for us to prescribe herbs. We get herbs that are prepared in China or Taiwan, and they're high quality. I've been to China. I've audited the plants where the herbs, meaning the industries where the herbs are made, and they're vast. And they come, I don't have a sample here to show you, but they come in fine powders. And so they have these incredible processes where they put all those, they go to the farms, they assay people might have questions about the quality of herbs, if they're clean, if they're pure. I can attest for you, I've seen it. I see the assays. They do high performance liquid chromatography. And so you get these assays that show that they're not contaminated with heavy metals, fungicides, pesticides, molds, etc. So the herbs that I use and that most of my colleagues use now are very high quality Chinese products or Taiwanese products that deliver good therapeutic value, and they come in granules in 100-gram bottles.
That's amazing.
200-gram bottles or whatever, 300-gram bottles.
Yeah. Well, it's amazing that you don't have to worry about the molds and the pesticides and herbicides, because that's huge. The fact that you can be rest assured that what you're putting in your body.
Yeah. And, there's a lot of, in our society, there's a lot of Chinese descent. There's a lot of negative feelings in general towards China, and for whatever reason, I don't get into that political stuff with patients. I just leave that alone. But the medicine that was developed over thousands of years that we practice, that's been refined, of course, and made modern, that we practice today, is very high quality. The instruments that we use, the Chinese herbs or the Taiwanese herbs that we use, very high quality. It's a huge industry. The Chinese herbal products are supplied all throughout Asia, all throughout Europe, and even in some hospitals in America. One of my colleagues, Bill Egloff from Crane Herb Company, has been instrumental in getting herbal medicine into hospitals across the United States, which is pretty impressive. Because you go to China, and I've toured hospitals in China, and Chinese herbal medicine is in the hospital. Acupuncture is in the hospital.
Nice.
Massage, Chinese remedial massage, which we call Tui Na, is in the hospital, right alongside all the other, Western, surgical units, rehab units, et cetera, ER, et cetera. Chinese medicine, traditional medicine's right in there too.
That's amazing. That's wonderful. So I'm curious. So you have your private practice, and then you have the home care, and then you're the director for the college or the institute. Do you teach as well at the institute, or you just serve a director role?
Right now, I'm serving as a director role since I'm relatively new with the California Institute for Human Science. I am teaching a community event. It's one of our extra programs that we're putting on, and that's going to be on 5 elements in coaching. Basically, what are the 5 phases of Chinese medicine, and how can we use that in understanding ourselves, and also in coaching relationships. So people that are in counseling or in coaching roles, they don't have to be a clinician to benefit from this course.
Okay.
So that's coming up in, I think, the middle of November.
Okay.
And we can
Okay.
link that. I'll have, we can link
Yeah.
that.
Yeah.
And so I taught a lot for the Pacific College of Health and Science, formerly Pacific College of Oriental Medicine, where I was the academic dean and the director of their clinic. I'm not teaching so much right now since I'm focused a lot on my private practice and my directorship here. I'm helping the students, with their PhD and master's programs and bachelor's completion program here.
Yeah. So you have a busy schedule.
Pretty busy.
Yes. Yes. Well, I really appreciate you taking the time to join us today in the middle of all of that. If people want to learn more or to even get information about that course, what's the best way that they can reach you?
They can reach me through the college here.
Okay.
And we can have links in there, but G Lane, GLANE at cihs.edu.
Okay.
That's a good way to reach me. That's my email.
Okay.
I won't give you my cell phone because
No, we don't need that. We don't need to do that. Email's great. You can filter email.
Email's perfect. Yeah.
Yeah. Well, I appreciate it. Anything that we didn't cover that you had wanted to cover, or did we kind of touch on everything?
Oh, I think it's great. I just really encourage people to, to always keep learning. That was a commitment, that I made long ago, is to, continually learn. Even with Chinese medicine, I've been doing it for 30 years, right? Since 1994, I started studying, and I'm just barely scratching the surface of what's out there and what's possible. And so I just love the learning process. I love being of service, so it just gives me great pleasure to help in any way I can. So I appreciate you inviting me on the show.
Absolutely. Well, thank you so much for joining us today. What a pleasure. And thank you all for joining us. Have a great rest of your weekend, and we'll see you next week. Take care now. Bye. Bye.